Public concern over the current third wave of COVID, which is growing, is rocketing at the moment. We're seeing that in opinion polls over some newspaper front pages this morning. How dangerous is this third wave in your view?
So I think any rise in cases risks increased numbers of people being hospitalised, risks increased numbers of people dying. And therefore, while the government has made the decision to open up further on July the 19th, I think it's really important that we stress the importance of public health messaging. We need to be careful to keep our distance, keep our social contacts low, wear masks in enclosed spaces, despite them not being legally required after July the 19th. And most importantly, if you've got any symptoms, go get tested, use the asymptomatic tests where you can, and then isolate when you're asked to do so. Those are the measures that will help keep the case numbers down and stop the rise in cases that are rapidly occurring at the moment.
You just broke out there at a tiny bit of your reply, which sounded quite important. You said, despite masks, etc., not being legally required, we just missed the bit you just said on the end, because the government, it now appears, is releasing new guidelines this week on what people should be doing. I don't think we were expecting those.
So, I mean, I think from my point of view, as a public health person who is advising, I would strongly advise that we continue to wear masks indoors in crowded spaces, especially amongst people who you don't know personally and aren't part of your household or your close contacts. I would also advise them on public transport because that is an often crowded space where you don't have any idea who you're in contact with. They prevent the infection that you may have unknowingly spreading to others.
Okay. Can I talk a little bit about hospitalisation admissions with you? So they're now up to roughly 500 or so a day as a weekly average. That is significantly higher than had been predicted by government officials, government modellers. Why is that?
Well, I think the models that have been present a range of figures that can go in a variety of different directions. What we're seeing is a rise in the number of admissions because the case numbers have risen very dramatically in the last 10 days. What we're also seeing is we're seeing rises in numbers of admissions going up the age groups. So it really manages to find people who are not vaccinated. And of course, vaccination, while it's highly successful at reducing hospitalizations, it is not 100% effective. So a small amount of people of a big number is still a large number, and that's what we're seeing. So we would advise caution in what people do in their interactions to prevent that rising further.
We spoke about this with the vaccines minister Nadine Sahami in the last hour, but SPI-M, the modelling group for SAGE, modelled 3 scenarios back in June for what the numbers could look like on a July 19th full reopening, what the numbers could look like at their peak. Now, some were quite optimistic, but the pessimistic one said new patients admitted to hospital could peak at close to 3,000 a day, perhaps towards the end of August, beginning of September. And that's very close to the peak of the first wave in April 2020. How possible is that pessimistic scenario to you now, looking at the numbers as they are?
So I think the numbers that we'll see being admitted to hospital is a direct relationship to the numbers of cases that we'll see. What we're seeing is that the numbers of cases aren't directly related to what we've seen in the previous waves, but we are seeing a proportion of those come into hospital on a daily basis, where we were seeing 2 to 4% of people coming into hospital before. It's now 1 to 2%. So if the cases get very high in the community, that will reflect in hospital cases. And we've had rapid rises in hospital admissions over the last week because of high case rates in the last 2 to 3 weeks. In my view, all of those ranges are possible. But it will depend on the behaviour that we as individuals and the population overall do. If the transmission rate, the traditional R number, rises close to 2, then there's highly likely that we will see very high numbers of hospital admissions. We all have within our control how we can keep that down by keeping our contacts low, by wearing face coverings, by doing a number of factors, such as working from home if you can. I know the government are very keen to get people back to offices, but I think over the next 4 to 6 weeks, that needs to be very cautiously implemented by businesses to keep transmission down.
So your advice would be, if anyone's listening to this, please don't try and get your workers back into the offices now. And whatever the government is saying about how helpful that'd be for the economy, please advise your workers to keep on staying at home if they can.
Yeah, so I think there's advantages of being in workplaces, and many people have to go into workplaces. You know, we see our NHS workers, our social care workers, people in hospitality and factories. They all have to go to work, so they need to be protected in different ways by doing regular tests, wearing face coverings. If you are able to do your business effectively from home, then I think over the next 4 to 6 weeks with rising cases, then we should try our best to do that. And then we should continue to look and see and have a cautious return to the office over the coming weeks once we start to see a decline in the number of cases.
Why are the government saying this? I mean, would you prefer the government to say, actually, do you know what? Last week was last week. This week is this week. We would now rather everyone did continue to work from home.
Well, I think they have said that the work from home is no longer mandated, if you like, so that they're basically moving it to a more libertarian position. But each business has the organisation to be able to decide what it wants to do for its employees. I think in the next few weeks, with rising cases, we should be cautious individually and collectively. And then once the case numbers start to decline, then we can start having a more active discussion about returning to the office environment.
But only once case numbers are on the decline.
That would be my preference as a public health person whose job it is to try and keep the infections down, and by advising people, the public and government on that.
Okay. Hospitalisation numbers are doubling once every 2 weeks roughly now. How long do you think that rate of incline will continue before the vaccination effect kicks in, if you like, and that steep curve begins to flatten? Can you see that far ahead and do that mathematics, which I accept is quite complicated?
Well, it is very complicated, and that's why the SPI-M models give a variety of scenarios. We are approximately, 3 doubling times away from the peak. So if we think about the peak hospital admissions in wave 2, where there was almost 4,000 coming in a day. So that would mean that over the next 6 weeks, we have a challenging time to watch and wait to see how that translates. Clearly, the more people who take up their offer of their second dose of vaccine, which is now critical over the next 4 weeks, the less that will impact on the less there will be an impact on hospital admissions. But we still have a really important thing to prevent cases, because the more cases we have, the more consequences there are for people who are vulnerable, people whose immune systems are less likely to respond to the vaccine, and also to prevent any of the consequences of long COVID, which we're only just learning about. And really, it's not a time to be over enthusiastic about social contact.
So 3 doubling times away from the peak. So if we're 500 now, my primitive maths would put a potential peak of 4,000 hospitalizations a day.
And that's 3 doubling times away from where we are now, and that's 6 to 8 weeks potentially, unless things change and unless we keep the transmission rate down and the rate of hospitalization starts to fall. Right.
Well, that's quite worrying, I would suggest. I think you're probably suggesting that as well. We are potentially 8 weeks away from 4,000 hospitalizations a day, which I think would be a record throughout this pandemic, wouldn't it?
So that was pretty much the similar number that we saw in the second wave. So I think it was about 3,800 to 3,900 on our worst days in the second wave. We really don't want to do that again. We really don't want that impact on hospital, people coming into hospital. We don't want that impact on the NHS. And I know that NHS workers really will find it difficult to go through that again.
The vaccination rate has halved in the last 2 weeks as well, as at the same time we've seen this very alarming spike in cases and now hospitalisation. So we're down to below 100,000 first jabs a day. Do you worry that we've now reached a plateau as a country? We just simply cannot persuade young people to come forward in the sort of numbers we need, and they're stuck on, people in their 20s, roughly 60% getting this vaccine? Because what we do know is that there's no lack of supply problem with the vaccines. It's just a lack of demand, people coming forward.
I think young people always perceive themselves being less at risk of this sort of infection, and they are personally much less at risk, but they're still at a small risk for patients. And clearly there's also risk for themselves, their families, and their social contacts. We urge all young people to take up the offer of vaccine. It's there, it's available for everyone over the age of 18, even if you've had the infection before. Good evidence that, getting a vaccine boost, even if you've had the infection in the past, really helps prevent you to get further infections. And so I would urge people, if you've had an infection, before just go and get your vaccine. If you've had your first dose, go and get your second dose. It is the critical path we have to find our way out of the pandemic. And we're very lucky in this country to have such vaccine supply. Many parts of the world don't have it, and we should take up the offer.
The Delta variant does appear to be reinfecting people now who may already have had COVID, may already have had the Alpha variant, the Kent variant. That's something you're seeing quite a bit, is it?
So we're seeing people who've had infection in the past get reinfected here again. Some of those people who've had an infection in the past were infected in February, March, April, so over a year ago. And we always know with respiratory viruses, there is a risk of reinfection again. We're not seeing dramatic rises in that rate of reinfections, and we're not seeing massive vaccine failures, but we know that the vaccine doesn't protect 100%. It actually protects about 60 to 70% after 2 doses for symptomatic infection and 95% against hospitalization. So what we're saying to people is that, take up your offer, get that boosted effect from the vaccine. That will protect you not just this month, but also over the covering 6 to 12 months when we will see more cases of this virus in our community. And we will have to try and manage as we open up the economy and open up society with other respiratory viruses as well.
Very clear message there on vaccinations from you there. Long COVID is another growing concern, isn't it? I think it's right to say 10 to 20% of all COVID sufferers end up going on to develop some sort of long COVID. Is that a right sort of statistic in your mind?
Yeah, so I think long COVID is a variety and a compilation of a variety of different syndromes. We know that some of these people will have symptoms like cough, loss of taste, loss of smell for a number of weeks and maybe even months. These sort of symptoms are common after viral illnesses, but we've seen so many viral illnesses this year. We're seeing a large amount of people with it. I would commonly advise in my clinical practice that after a viral illness or a pneumonia, that you would expect to be tired and fatigued for weeks to months, and that you would expect to have a cough for 4 to 6 weeks as a minimum. What we need to understand is the people who will have, who aren't able to get back to their daily living, so not able to get back to work, really feeling that difficulty in consequences potentially on their heart, their lungs, and those people we're trying to study further so that we understand the differences in the syndrome between people who have what we would consider a consequence of having a severe virus or any virus versus those that will have consequences longer for them being able to reintegrate and get back to work.
When you look at long COVID rates increasing at quite a dramatic level, when you look at hospitalisation numbers potentially rocketing, as you and I just discussed with that doubling, and when you look at a slightly alarming reduction in the vaccination rate, that dropping off now amongst young people, as a doctor in command of all of those facts, do you really think it's safe to move to step 4 in just 8 days' time?
So I think, the challenge in moving to step 4 is that, we will have to do it at some point. And the modelling has looked at a lot of different time points in doing this. It was very clear from the modelling that the delay from June to July in the reopening was advantageous in getting more people vaccinated, especially first doses, and to increase the numbers over 40 who had had their second dose. It is more complicated now, and many people have looked at this from many different directions. If we delay now again, then we could push the peak of this wave into September, October, and we have schools then reopening and all of the can occur around the school environment and the socialization around school. If we push it even further, then it could mean the peak is associated with our normal winter peak, which always puts massive pressure on the NHS. And so that would cause challenges then. So I think it's a balancing act. It's a fine balancing act. I don't think we know the right answer, but I would say that no matter when we do it, it's about our own human behaviours that will drive the rate of increase of cases.
Right. Okay. But my question was simple, albeit a bit of a simpleton's question. But that's what the government might have asked people like you. Should we be doing this? In fact, the Prime Minister is apparently deciding this now. We all know he's going to do it. But if he asked you and said, look, should I reopen on July the 19th? You're one of Public Health England's best doctors. Or should I just wait another 2, 3, 4 weeks to just get more jabs into people's arms, more second doses into people's arms, which will protect them? What would you say?
So my job is to say, if you wait another few weeks, we'll get more jabs into arms. But what will happen is we'll push the wave of infection that we're seeing to late August, September, October, and that we have to weigh that up against now. And the government's job is not just to weigh up my health advice, but also to weigh up the economic advice as well. And they take a wide variety of inputs to make those decisions.
Okay, Dr. Collins, I have to say I'm not hearing an overwhelming, ringing endorsement of step 4 on July the 19th from you.
So I don't think anyone could ringing endorse the steps that we're doing. If we knew the answer, absolutely, then we would be able to do that. Sadly, it is hard to predict what's going to happen. What I'm saying is that the public health advice is to be very cautious in your social interactions, no matter what happens on July the 19th. Wear face coverings and get vaccinated.
Understood. I probably pushed you enough as your medical remit comes on that perspective. But the government has, we know this because they made it clear in their guidelines last week, although slightly quietly, set out the right to reimpose restrictions if cases, hospitalisations get too high. And we've talked about where that trajectory is, especially in the autumn, with the NHS under greater pressure from a lot of other things happening at the same time. Do you personally think there will be a need for to reimpose some restrictions, some mandatory restrictions, large groups gathering or face masks in crowded places, whatever it might be, come the autumn?
So I think that if cases rise so that they cause an impact on hospitalizations and they cause an impact on ICU admissions, then government will need to look and decide whether they need to reimpose restrictions like they have done in the past. I think that we are going to have to learn to live with this virus. There are simple measures that we can do to prevent transmissions: testing, tracing, isolating, wearing face coverings. All of those things can keep. We will have to, if there's a point where the NHS cannot cope, then the government will have to take a sharp action to prevent it becoming overwhelmed. I think that then we are where in spring, but I would be cautiously optimistic that that wouldn't need to happen, but I think that at any point it could.
Again, you just broke up a tiny bit. If you could just possibly repeat your last sentence. You're optimistic?
I'm cautiously optimistic that we will not need to impose restrictions again because of the vaccine uptake and because of all of the other things that we have in place. But we need to be open to the idea that at any point that may need to happen at short notice.
But that, of course, depends on how people behave over the next 4 to 6 weeks.
Yes.
Hello, it's Isabel here. Dr. Hopkins, Blood Cancer UK have accused Public Health England of giving misleading advice on the efficacy of the vaccine for their patients who they represent. Have you let people with blood cancer down?
So, the Public Health England's vaccine team have done an analysis with multiple academic partners, looking at the vaccine effectiveness in those that are clinically vulnerable and showing that those that were clinically vulnerable had a good response to 2 doses of vaccine, highlighting the importance of all of those individuals taking up their second dose. What it did not say was should wave caution to the wind, or it did not say that the blood cancer patients in particular had an excellent response to vaccine. It didn't say that at all because there were not enough patients in the study who had specific blood cancers. So I think what the message has been is that clinically vulnerable people respond to vaccine overall, and individual studies looking at individual case groups are still underway.
But that's the Blood Cancer UK organisation has said they have no issue with the study itself, but with the way it was then represented in a press release, which they say was highly misleading and has already caused a lot of damage.
So I have to say I've read that press release. I don't see that in it, though I would completely understand why blood cancer charities want to protect people with blood cancer. There are the people who have the least likely to respond effectively to vaccines because we need the cells from our blood to mount an antibody response. However, neither the paper or the press release stated that blood cancer patients were protected.
Who is leading work for the immunocompromised community in this country? Is there a single person in government who is in charge of that?
So the immunocompromised individuals and clinical shielding falls under the remit of the Chief Medical Officer, and the Deputy Chief Medical Officers assist on that remit. And I think that there has been a large number of studies funded by the Department of Health and Social Care to look at the response to vaccines, including the COVID Immunology Consortium and a number of studies that are looking at the response in blood to vaccines and the responses overall to vaccine effectiveness.
And finally, it's been reported that some 13,000 women have reported changes to their periods after being vaccinated, some quite dramatic changes. Are you worried about a long-term impact of the vaccine on reproductive health?
No, I am not. It is quite clear that these vaccines will have no difference to reproductive health than other vaccines. I have no evidence at all that these, either the mRNA vaccines or the vaccines with the adenovirus vector, will have any consequences on reproductive health whatsoever.
So it'll just be a brief delay to a period. And nothing beyond that.
I mean, like with anything, if you've been unwell or you have a vaccine response, that is, you can have a delay to your period. That is not the same as having any impact on your reproductive health.